Well, good afternoon, everybody. We are now getting into the next phase of not only our planning, but to begin the process of actualizing those plans in real time. Let me give people an update on where we are in the state of California. In particular, in the last 4 days, we have seen a doubling of the number of hospitalizations related to COVID-19. In the last 4 days, double the population that's been hospitalized. We've also seen a tripling of the number of ICU patients in our system in the last 4 days. These have long been projected based upon our modeling. Consequence, we have for weeks now been organizing ourselves around a surge that will require roughly 2/3 increase in capacity within our hospital system. That requires three fundamental things. It requires finding new places to put people. Number two, requires having adequate supplies from PPEs to the ventilators. And importantly, number three, requires people. And today we are announcing a new effort, healthcore.ca.gov, healthcore.ca.gov, that will provide a platform to match individuals that may have retired in the last 5 years, may be in the process of getting licensed or relicensed, people that are in nursing schools or medical schools that are nearing the completion of those efforts, to incorporate and encourage them to get on this platform to provide for the kind of human capital surge that we'll need to meet the moment over the course of the next number of weeks as these numbers continue to rise. We couldn't be more pleased by the incredible professionalism of our nurses and doctors, our professional representatives that came together across many differences and organized around a framework of providing more flexibility, more surge capacity within the system, by providing scope of practice reforms, by allowing us to utilize our existing resources in a more resourceful way. I want to thank all of the representatives for putting aside, again, those differences and meeting this moment head on to provide the flexibility that is required to meet this moment. We have an executive order that went out that will provide flexibility through June 30th. This is temporary flexibility on staffing ratios, on scope of practice for nurse practitioners, EMTs, and others. We are going out now to deeply find the kind of talent, though, that is necessary beyond the scope of practice changes and beyond the regulatory changes, and to make sure that we have the adequate workforce, looking for mental health experts, looking for more EMTs, more pharmacists, looking for more phlebotomists, looking for more experts in respiratory care and the like, technicians, administrators, doctors, nurses. We are calling on you to step up and step in and meet this moment. We have more licensed healthcare professionals in the state of California than any state in the nation, some 766,000 professionals in the state of California. But we estimate we have the capacity to increase our ranks by an additional 37,000 plus professionals that are in that time of life where they, again, may have just recently retired, or they're in the process of getting their license and their degrees. And so we are very, very hopeful with this effort that we will see a surge of individuals to be paid and compensated to participate in the workforce and distributed throughout our care delivery system all around the state of California. I will have an individual and representative here in a moment to talk more specifically about what that means, and also to remind everybody it's National Doctors Day in the United States of America. And again, just deep respect and admiration for all of our frontline employees for meeting this moment. I also want to express deep respect and admiration to Mark Zuckerberg and Facebook, well aware of the need to surge with our healthcare capacity. They are providing stipends for individuals that need transportation funding, that need childcare support, if they're going to participate in this workforce, that can get the kind of support on things that otherwise we wouldn't be paying for. Things not just like childcare and transportation, things like hospital, or rather hotel rooms and accommodations. So they put up $25 million, and we're very grateful to Facebook for providing those stipends to help us in areas where we need a little bit extra support. Again, that's the spirit of California. That's the spirit of this moment. It's the spirit that's driving our resolve. Driving that resolve as well is the aggregation of all of these physical assets that have taken place and shape over the course of the last few weeks. From the USNS Mercy that now took their first patients just yesterday in Los Angeles, to the 2,000 rooms that will be surging from the support of the federal government, these field medical stations. We already have our Santa Clara operation up and running. We have Riverside up and running. We have work being done in Los Angeles and San Mateo that will share some of that surge in San Francisco, part of the FMS process, again, already operationalized. Seton Hospital already operationalized, that we brought into the portfolio of assets here in the state. We've been talking over the weekend to get St. Vincent, 366 beds in Los Angeles, fully staffed up as well. And we'll have some specific announcements on that in the next few days. Community Hospital down in Long Beach, we're starting to see that all take shape in real time. We have other hospitals we've identified in addition to the FMS sites and the USNS Mercy. We are also looking to get some 1,000 skilled nursing facility units up and running, and we have indeed made real progress in other areas from Fairview and Porterville, and now working with the Army Corps of Engineers that has now looked at 15 high-priority sites. They have got 4 more that they'll be looking at, from the Sleep Train Center here in Sacramento to Oakland Coliseum, to the LA Coliseum, and other sites throughout the state of California, looking at those sites as potential surge sites, all part of the plan to increase by 50,000 beds our available capacity within our healthcare delivery system. We have distributed now some 32.6 million N95 masks in the state of California. We have our sights on getting that 101 million that we have locked up into the state. And every couple days, more of that PPE comes in, not just N95 masks, but coveralls and shields and gowns and gloves, glove sets and the like. And so as soon as we get them in, we get them out. Yesterday, we were getting in a number of ventilators into Bloom Energy for refurbishing and reconfiguration. I'm very pleased the 150 that came from LA as part of the national stockpile, all of those have been completed and are done and are being sent back out into LA County. And I just want to encourage folks, if you have a line on ventilators, it doesn't matter if they're brand new. Maybe you have a few pieces lying around your basement or the house. I don't mean to be flip here or flippant. We'll take them. We've got the folks here in Silicon Valley that can do miracles with old equipment and refurbish that equipment. I just mentioned a few days ago that our community college system, they found 192 ventilators, not all of them in perfect shape, some of them used for training and the like, but we'll take whatever we can get. We currently have 4,252 ventilators that we've locked down. Our goal is to get to 10,000 ventilators. We're looking to procure new ones from around the globe, and we're hopeful that the federal government can assist us beyond the 170 that came into LA County, but if they don't, we'll be as resourceful as we possibly can. So on the physical asset side, that surge of 50,000 beds, we're making real progress. On PPE and lining up and identifying those needs, we're making progress, but still more needs to be done. But as it relates to personnel and people, nothing more valuable and nothing more potent to meet this moment. And so if you're a nursing school student, a medical school student, we need you. If you've just retired in the last few years, we need you. If you are looking to expand your scope of practice and have particular expertise in any particular capacity, we need you, and we encourage you to take a look at that healthcore.ca.gov website. 5 simple steps. We'll ask you basic questions, and we'll help you with your relicensing. We'll help you with the protocols and processes to get you up and running and get you out the door so that you can support the needs of people of the state of California all throughout our state. We've seen an increase, a modest 8.3% in terms of the total number of positives last night, 5,763 total COVID-19 positives in the state of California. But it's those hospitalization numbers, it's those ICU numbers that we are most focused on. And again, those numbers are starting to go back up again along the lines of our model. So the next few weeks are going to be critical in the state of California. In the next few weeks, we're going to need more to flex and to surge and do more together to meet this moment. And before I turn it over to the doctor, I want to just remind people of how they can meet this moment. All of you that have the capacity to contribute can contribute most significantly by practicing physical distancing, by continuing the good work that we've done in this state, including over this weekend. We had to shut down all 280 parking lots in our state parks system. We saw a reduction in the kind of surge of activity in our parks and on our beaches compared to the previous weekend, but we want you to continue to do that. There's nothing more potent and powerful in terms of meeting this moment than practicing that physical distancing. Socially connected, let's be resourceful in addressing the needs of others. And I couldn't be more proud of our partnership with Nextdoor and the volunteers, some 8 million people they were able to connect with, to check in on our seniors, to check in on people that are struggling with social isolation and may need not just food and medicine, but also may need a person to call, just check in and see how they're doing. So nothing more important for individuals, if they want to contribute in this moment, that continue to do the incredible work you have done in the nation's largest state to practice physical distancing. Number 2, I just want to remind people that if you know anybody in the medical profession, if you know people that you think are willing to contribute their time and energy in a compensated way, to go to this new website so we can meet the healthcare surge as well. So partners, well, across the spectrum, private sector, Facebook, the public sector, with incredible contributions of nonprofits and civic-minded individuals, will continue to row in the same direction, continue to meet this moment as we have in the state of California. In addition, and I'm happy to answer questions, we are significantly increasing our efforts on homelessness. I'm happy to go into detail